All right, everyone get ready, because today we're going to be looking at something that I think everyone should know a little bit about at least, and that is urologic trauma.
Uh-oh.
We're going deep.
It sounds a little scary.
It can be, but we're going to be diving deep into a 2010 review article from Nature Reviews Urology called Urologic Trauma Guidelines, a 21st Century Update.
Okay.
And the authors, Santucci and Bartley, they're basically giving us like the cheat sheet, the cliff notes, whatever you want to call it,
Yeah.
on what the European Association of Urology recommends for dealing with injuries to the kidneys, the ureters, the bladder, the urethra. You name it, they're talking about it.
Well, you know what's fascinating to me about all this
What's that?
is that, we always think about trauma as these freak accidents, but trauma is actually the #1 cause of death for people between 1 and 44 here in the U.S.
Wow.
And that includes things like car accidents, falls, violence, you name it.
Yeah, I guess when you list it all out like
And how are you ready for this?
hit me.
The genitourinary system is involved in about 10% of those cases.
10%.
Yeah, so this isn't just medical trivia. This is actually something that could come in handy for you.
Yeah, that number really stood out to me. That's a lot higher than I would have thought. So let's start with the basics. Like, what's the first thing a doctor needs to figure out when someone comes in with potential urologic trauma?
Well, the absolute priority is to separate the life-threatening situations from the ones that we can stabilize and maybe deal with a little bit later.
Right.
So imagine a patient comes in after a car accident. We need to know right away if they're bleeding internally, if their blood pressure's crashing, if there's any spinal cord injuries. Those things take precedence over, say, a small kidney laceration.
Right.
So it's about triage.
Yeah.
Figuring out who needs that immediate life-saving attention.
Absolutely. You got to prioritize, and I guess there's kind of a spectrum there.
Exactly. And while this article is focused on the more, dramatic stuff, the blunt force trauma, the penetrating trauma, it also acknowledges that sometimes these injuries can happen during medical procedures.
Oh, wow.
It's called iatrogenic trauma, and it's just a reminder that even in the controlled environment of the hospital, things can still go wrong.
Yeah, that's a good reminder that you never know. Complications can happen.
Absolutely.
All right, so let's get into specific organs now.
Yeah.
The article mentions that the kidney is the most frequently injured organ in the genitourinary system. Is that true?
It is. It
Wow.
is. In fact, 1 to 5% of all trauma patients, not just those with GU trauma, have some degree of kidney injury.
Oh, wow.
So that's a pretty staggering statistic.
So 1 to 5% of IL trauma patients, that's even more than that 10% that you mentioned earlier.
Exactly.
For GU, that's a lot higher than I would have expected. And I mean, I bet that makes people nervous, but I'm guessing the good news is that treatment's gotten so much better that doctors are better at saving kidneys now.
Yeah, absolutely. Advances in imaging, particularly CT scans,
Yeah.
allow us to see the extent of that injury in really incredible detail.
Yeah.
And surgical techniques have come a long way as well.
Yeah.
So now, in many cases, we can manage kidney trauma without surgery at all.
Wait, hold on. No surgery
Yep.
for a damaged kidney. That sounds almost too good to be true.
Wow.
How's that possible?
The kidney has a really remarkable ability to heal itself if you give it the right conditions. So, for example, let's say a patient has a minor laceration, but they're otherwise stable. We might just monitor them closely, make sure they're resting, give them some pain meds, maybe some antibiotics to prevent infection, and just let the body do its thing.
So you're just basically letting the body heal itself.
Exactly. It's
Oh.
called conservative management.
Conservative management.
And it's been a real game changer in the field of urologic trauma.
I bet.
In fact, some studies suggest that conservative management may actually lead to better long-term kidney function than surgery in certain cases.
That makes sense. Less invasive, fewer complications.
So exactly.
But let's say someone does have more severe kidney damage. What are like the red flags that tell doctors, okay, we got to do surgery now. This is unavoidable.
Well, there are 2 absolute indications for surgery in kidney trauma.
Okay.
The first is uncontrolled bleeding that's putting the patient's life at risk.
Makes sense.
So you can imagine, like, a major artery is severed, the kidney is essentially hemorrhaging.
Yeah.
In that situation, you have to go in immediately and stop that bleeding.
Yeah, I feel like we see that in medical dramas all the time.
Exactly.
It's just gushing blood. You got to stop it.
Exactly. Now, the second absolute indication is an expanding or pulsatile hematoma.
Okay.
So basically a collection of blood that's either growing rapidly or it's pulsing with every heartbeat. And that tells us there's a major vascular injury and we got to go in and fix it.
Okay, so those are the two scenarios where there's like no debate, you go in right away. What about the situations where it's not so clear cut? Are there like gray areas where doctors have to kind of weigh the risks and benefits?
Yeah, absolutely. We call those relative indications for surgery.
Relative indications.
So, for example, let's say a patient has persistent bleeding. That's not immediately life-threatening, but it's not responding to conservative measures.
Okay.
Or maybe we suspect there's an injury to the renal pelvis. That's the part of the kidney that collects the urine.
Yeah.
Or to the ureter, the tube that carries urine from the kidney to the bladder.
Right.
In those cases, we have to carefully consider whether the benefits of surgery outweigh the risks.
It's a judgment call then.
Exactly.
Kind of looking at the whole picture of the
Yes,
individual.
exactly. And we have to be careful about rushing into surgery because, as with any procedure, there are potential complications. Infection, bleeding, damage to surrounding organs, these are all things we have to take into account.
Absolutely, yeah. You don't want to create more problems by trying to solve the first problem.
Okay.
Well, I think what's striking to me about all this is how much the approach to kidney trauma has shifted. It seems like the default used to be surgery, but now it's a lot more nuanced.
Absolutely. There's been a real paradigm shift in recent years toward this conservative management. We've realized that in a lot of cases, the body can do an amazing job of healing itself if we just give it a chance.
Yeah, that's pretty amazing when you think about it. Now, I know a common sign of kidney trauma is blood in the urine,
Right.
or what doctors call hematuria. But the article mentioned something kind of counterintuitive about that. What was that?
Right. And this is really important for people to understand. The amount of blood in the urine doesn't necessarily correlate with the severity of the injury.
Oh, really?
You could have microscopic hematuria, just a few red blood cells that you wouldn't even see with the naked eye, and have a serious injury. Conversely, you could have gross hematuria, where the urine is visibly red, and have a relatively minor injury.
So you can't just go by how much blood there is.
Exactly. And that's why doctors use a multi-pronged approach to diagnose kidney trauma. They look at your vital signs, your symptoms, the results of imaging studies, all of that.
Well, speaking of imaging, the article mentions that CT scans are the gold standard for diagnosing kidney trauma. Why is that?
Well, CT scans with contrast dye let us see the entire kidney in amazing detail. We can see lacerations, contusions, areas of bleeding, and even injuries to the renal pedicle.
Okay, back up for a second. What's the renal pedicle,
Right.
and why is it so important?
All right, so imagine the renal pedicle as the main highway supplying blood to the kidney.
Got it.
It carries the renal artery, which brings in oxygenated blood, and the renal vein, which takes away the deoxygenated blood.
Makes sense.
If that renal pedicle is injured, the blood supply to the kidney can be cut off, and that's a real problem.
Yeah, you need that blood supply.
Exactly.
So a CT scan can actually show if that lifeline is damaged.
It can. If the contrast dye isn't flowing into the kidney tissue as it should, that's a red flag that something's up with that renal pedicle.
That's wild. It seems like CT scans are pretty essential then in these cases.
They are, but here's where things get interesting. Not everyone with suspected kidney trauma needs a CT scan right away. A landmark study back in 1989 by me and his colleagues challenged that scan everyone approach.
Okay.
They found that in patients with blunt trauma, microscopic hematuria, and stable vital signs, the chances of a serious kidney injury were actually pretty low.
So in those cases, they might hold off on the CT.
Exactly, especially in children where we're always concerned about radiation exposure.
Right.
The risks of the scan might outweigh the benefits in those situations. It's all about making informed decisions based on the individual patient's presentation.
Yeah, case by case. Makes sense.
Exactly.
Okay, so we've covered kidney trauma in a lot of detail here. What's next on the list?
Well, let's move on to ureteral trauma, which is when the ureter, that tube connecting the kidney to the bladder, is damaged.
Now, I'm guessing that's a lot less common than kidney trauma.
You're right. Ureteral injuries only account for about 1% of all urinary tract injuries.
Okay.
And here's the kicker. Most of them are actually caused by medical procedures, not blunt force trauma.
So like a surgery mishap or something like that.
Exactly. So think about procedures that involve the pelvic area, like gynecological surgeries, colon surgeries, even certain urologic procedures. There's always a risk, albeit a small one, of inadvertently damaging that ureter during those operations.
Yeah, I guess even when you're in the hands of really skilled surgeons, complications can still happen.
Absolutely.
It's a little unsettling, but how do doctors even know if the ureter has been injured? Are there, like, telltale signs?
Unfortunately, there are no classic symptoms of ureteral trauma. That's what makes it so tough to diagnose. It often comes down to clinical suspicion.
Mm-hmm.
So, for example, if a patient has had a recent surgery and they're having flank pain, fever, or a decrease in their urine output, we got to think about the possibility of a ureteral injury.
So it's a bit of a detective game,
Exactly.
trying to piece together the clues.
Exactly.
So what tools do doctors use to kind of make that diagnosis?
Well, imaging plays a crucial role here. Sometimes we can actually spot the injury during surgery.
Okay.
So imagine you're performing a hysterectomy and you see this little puff of blue dye escaping from the ureter. That tells you you've got a leak.
Oh, wow.
So we often use intravenous dyes like methylene blue to help visualize the urinary tract during surgery.
It's like a real-time leak detector.
Exactly.
That's clever. But what if the injury isn't detected during surgery? What happens then?
Well, we might do a CT scan, which can sometimes show that dye leaking from the ureter.
Okay.
Or the ureter might not even be visible at all on the scan, which is another red flag.
Got it.
If the CT is inconclusive, there are other imaging tests we can do, like a Kojubi X-ray or a retrograde pyelogram.
Okay, well, I'm sensing a theme here.
What's that?
Intravenous dye seems to be like a key tool in urologic trauma.
Absolutely.
But let's say they DO find a ureteral injury. What are the treatment options?
Well, the treatment depends on the severity of the injury. Okay. For minor injuries, we might just put in a stent. That's a tiny tube that helps keep the ureter open and allows the urine to drain properly. So think of it like a little scaffold holding the ureter open while it heals.
So it's like a bypass for the urine.
Exactly.
Okay.
But for more serious injuries, we'll need to surgically repair the ureter.
Right.
We have a variety of techniques for doing this, depending on the location and the extent of the damage.
Yeah.
But the goal is to create a watertight connection so that urine doesn't leak out.
Right. And I imagine they'd place a drain to help with healing, just like they do with kidney surgery.
Absolutely. The drain helps prevent fluid buildup and infection.
Makes sense.
Yeah.
Now, this might be a dumb question, but what are the long-term consequences of a ureteral injury? I mean, is it possible to have lasting damage?
That's a great question, and it's definitely something we're going to delve into further in the next part of our deep dive.
Oh, all right. Stay tuned. So before well, not really a break since there aren't any, we were talking about how tricky it can be to diagnose those ureteral injuries.
Yeah.
I mean, no obvious symptoms and then the risk of long-term issues.
Right.
It really makes you realize just how delicate this whole system is.
It really is. And to your point about the long-term problems, one of the biggest concerns after ureteral surgery is stricture formation.
Stricture formation?
Hmm.
That sounds kind of ominous. What does that mean?
So a stricture is basically a narrowing of the ureter.
Okay.
Imagine like a kink in a garden hose.
Oh, okay.
It restricts that flow of urine from the kidney to the bladder,
Right.
which can cause all sorts of problems.
Even after a successful repair, you could still run into trouble down the road.
Yeah, unfortunately, that can happen. And the symptoms of a ureteral stricture can be pretty vague.
Mm.
You know, flank pain, urinary tract infections, even decreased kidney function. So it's something we monitor really closely in patients who've had ureteral surgery.
Okay, let's move on to another organ that I'm guessing gets injured quite a bit in trauma cases, and that's the bladder. I imagine bladder injuries are, like, incredibly painful.
They can be, and they're often linked to pelvic fractures.
Okay.
Think about it. The force needed to break a pelvic bone is significant.
Yep.
So it's not surprising that the bladder, which sits right in the middle of that pelvis, could be affected as well.
So if you see a pelvic fracture on an x-ray, you're automatically thinking about the bladder too.
Absolutely.
Okay.
And there are two main types of bladder injuries: extraperitoneal
Okay.
and intraperitoneal.
Those sound complicated.
Not really. Imagine the bladder as a balloon inside a box.
Okay.
The box represents the pelvic cavity.
Right.
In an extraperitoneal injury, the balloon has a hole, but that leak is contained within the box.
Okay.
So the urine is leaking out into the tissues surrounding the bladder,
Yeah.
but it's not spilling into the rest of the abdomen.
Got it. So what about an intraperitoneal injury?
That's when the hole in the balloon is so big that the urine leaks out of the box,
Okay.
meaning it spills into the abdominal cavity.
Well,
That's a much more serious situation because urine can irritate the lining of the abdomen and lead to peritonitis,
right.
which is a life-threatening infection.
So intraperitoneal ruptures always require surgery.
Yes, they do. We need to go in and repair that tear in the bladder and thoroughly wash out the abdominal cavity to prevent infection.
Okay.
But extraperitoneal ruptures can often be managed conservatively.
Wait, so you can have a ruptured bladder and not need surgery?
Yep.
How does that work?
It's actually surprisingly effective. We insert a catheter into the bladder to drain the urine and give the bladder a chance to heal on its own. And it works about 90% of the time.
90%. Wow, the body really can do amazing things. But going back to what we talked about earlier, sometimes there's blood in the urine with these injuries, sometimes not.
Right.
Could you have a ruptured bladder and not see any blood at all?
Yes, it's possible, though it is less common.
But it's one of those situations where we can't rely on symptoms alone. We need to use imaging studies to confirm that diagnosis.
And what's the go-to imaging test for bladder injuries?
A retrograde cystogram is considered the gold standard.
Retrograde cystogram.
We insert a catheter, fill the bladder with contrast dye, and take x-rays. If there's a tear, we'll see that dye leaking out.
So they can also use CT scans to look at the bladder, right? Just like with the kidneys and the ureter.
That's right. It's called CT cystography. But here's a crucial point. Whether they're doing a retrograde cystogram or a CT cystogram, they need to use enough contrast dye, at least 350 milliliters. Otherwise, they might miss a small tear.
So it's not just about doing the test, it's about doing it correctly.
Exactly.
Okay, we've talked about injuries that happen from, blunt trauma.
Right.
But what about bladder injuries that happen during surgery? We talked about those earlier with the ureters.
Right. Those are called iatrogenic injuries.
Iatrogenic, yeah.
And they're often handled a bit differently.
So let's say a surgeon accidentally nicks the bladder during a hysterectomy. They can usually repair it right then and there, often through the same incision they're already using.
So it's like a 2-for-1 surgery, unfortunately.
In a way, yes.
Yeah.
And if it happens during a prostate or bladder tumor removal, simply draining the urine with a catheter for a while is often enough to allow the bladder to heal, especially if it's an extraperitoneal injury.
Okay.
But if it's intraperitoneal, they'll probably need to do a surgical repair.
So it's a case-by-case situation.
Exactly.
All right, ready to move on to the next organ.
Let's do it.
All right, this one might make some listeners squirm a bit. Urethral trauma.
Yeah, urethral injuries, while not usually life-threatening on their own, can have significant long-term implications, particularly for men.
Right.
And they often occur alongside other serious injuries, especially pelvic fractures.
Given the location, I'm guessing diagnosing and treating these injuries can be really tricky.
You're right. The urethra is a delicate structure.
Yeah.
And even a seemingly minor injury can lead to long-term problems if it's not managed properly. Now, the first clue is often blood at the urethra opening, what we call the meatus. If we see that, we know there's damage somewhere along the urethra.
So what's the next step then? Do they just do a regular x-ray?
Not quite. We need to visualize the entire urethra. So we do a special x-ray called a retrograde urethrogram, or RUG for short.
RUG?
We inject contrast dye into the urethra and then take x-rays.
Okay.
The dye outlines the urethra, allowing us to see any tears, blockages, or other abnormalities.
So it's like a roadmap of the urethra.
Exactly. But here's the problem. Urethral injuries, especially those associated with pelvic fractures, are often misclassified, which can lead to the wrong treatment. So it's crucial to have an experienced urologist involved in these cases.
Yeah, you need someone who really knows what they're looking at.
Absolutely.
So let's say they've done the RUG and they've confirmed a urethral injury. What's the typical treatment approach?
Well, if the injury is relatively minor and we can gently pass a catheter into the bladder, we might just leave that catheter in for a while to allow the urethra to heal.
Okay.
The catheter keeps the urethra open and allows the urine to drain properly.
So no surgery in those cases?
Not necessarily, but even if we can successfully place a catheter, there's still a risk of long-term complications, particularly stricture formation.
Right. Remember we talked about strictures with the ureter?
Exactly. Same thing can happen in the urethra.
That makes sense. So what if they can't get a catheter in? What happens then?
Well, we might try a realignment technique. This involves using a flexible or rigid scope to visualize the urethra and gently guide that catheter into place.
So you're basically trying to reposition the urethra so the catheter can pass through.
Exactly.
Okay.
But even with realignment, there's still a high chance of stricture formation later on.
So it's kind of a Band-Aid solution?
In a way, yes. And if realignment fails, we'll need to place a suprapubic catheter.
A suprapubic catheter. That sounds intense. What is that?
It's a catheter that's inserted directly into the bladder through the abdominal wall.
Oh, wow.
It bypasses the urethra completely, allowing it to heal without the irritation of a catheter passing through it.
So it's like a detour for the urine. That makes
Exactly.
sense.
And once that initial trauma has settled down, we can then address that urethral injury more definitively.
And what does that involve? Surgery?
Often, yes. For posterior urethral injuries, those that occur closer to the bladder, the gold standard is delayed urethroplasty.
Delayed.
This means we wait a few months for the inflammation to subside, and then we surgically reconstruct the urethra.
It seems kind of counterintuitive to delay surgery, but I guess it makes sense to let things calm down first.
Exactly. Rushing into surgery can actually worsen the outcome in these cases.
Okay, so posterior urethral injuries are usually treated with delayed surgery. What about anterior urethral injuries? Those that occur closer to the tip of the penis.
Well, those are often caused by penetrating trauma, things like stabbings, gunshots, or even animal bites. And in those cases, immediate surgical exploration and repair are usually necessary.
I imagine with open wounds like that, the risk of infection is much higher.
You're right, and we also need to assess the extent of the damage and make sure there are no other associated injuries.
Okay, so we've covered kidney trauma, ureteral trauma, bladder trauma, urethral trauma. What's left?
We can't forget about genital trauma.
Right.
This is an area that often gets overlooked, but it's actually surprisingly common.
Okay.
In fact, somewhere between 1/3 and 2/3 of all genitourinary trauma involves the external genitalia.
Wow, that is a lot higher than I would have guessed.
Yeah.
And I bet those injuries can be, well, delicate to deal with, to say the least.
You're right. These are very sensitive areas, both physically and emotionally, and
Yeah.
managing genital trauma requires a lot of care and compassion.
Absolutely. So what are some of the most common types of genital trauma?
Well, in men, penile fracture is one of the most dramatic. It happens when the tunica albuginea, which is that tough fibrous sheath that surrounds the erectile tissue in the penis, ruptures.
Ouch, that sounds incredibly painful. How does that even happen?
Usually occurs from a direct blow to the erect penis or from forceful bending. So imagine someone falling on their erect penis or having it bent forcefully during intercourse.
I'm wincing just thinking about it. What are the signs of a penile fracture?
Well, there's usually a popping or cracking sound at the time of the injury, followed by immediate pain and swelling.
Yeah.
The penis will lose its erection, and there will often be bruising and deformity.
Deformity like what?
Well, it often looks like an eggplant, hence the term eggplant deformity.
Oh, okay. That's an image I'll never be able to unsee.
Sorry.
But seriously, what's the treatment for a penile fracture?
Immediate surgery is crucial to repair that tear in the tunica albuginea.
Okay.
If we delay surgery, there's a risk of permanent deformity and erectile dysfunction.
So no messing around with that one. Okay, what other types of genital trauma do you see in men?
Blunt scrotal trauma is another common one.
Okay.
This can range from a minor contusion to a testicular rupture.
A testicular rupture. That sounds awful.
It is. And again, surgery is usually necessary to repair that damage and preserve the testicle.
And I imagine penetrating injuries to the genitals can be quite severe as well.
Absolutely. We see everything from animal bites to gunshot wounds.
Wow.
And with animal bites, there's a specific concern about infection with a bacteria called Pasteurella multocida, which can be very aggressive.
Right.
So antibiotics are crucial in those cases.
Okay, what about women? What types of genital trauma do you see in them?
Vulvar trauma is fairly common, often occurring alongside other injuries like pelvic or abdominal trauma. It can cause significant bleeding and might require a catheter to drain urine.
So it's essential to assess the entire area for any, associated injuries.
Absolutely. We often do a CT scan to get a better look.
Oh.
And in terms of treatment, most vulvar injuries don't require surgery. Small hematomas, those are collections of blood, might just need ice and pain meds, while larger ones might need to be drained surgically. And lacerations or cuts are usually repaired with stitches.
Makes sense. This has been a whirlwind tour of urologic trauma.
Yeah.
It's amazing how much ground we've covered. But before we wrap up, I'd love to hear your thoughts on something that the authors emphasized,
Okay.
and that is the importance of a multidisciplinary approach to care.
That's a crucial point. Urologic trauma often involves other specialists besides urologists. We work closely with trauma surgeons, emergency physicians, radiologists, even gynecologists in some cases. It really takes a team to effectively manage these complex cases.
So it's not just about the urologist swooping in to save the day.
Not at all. It's a collaborative effort, and
Yeah.
communication is key. Everyone needs to be on the same page to make sure that that patient is getting the best possible care.
So can you give me some specific examples of how these other specialists might be involved?
Sure. Let's say a patient comes in after a high-speed car accident.
Okay.
The trauma surgeon is going to be the one stabilizing the patient, controlling any bleeding, making sure their airway's clear.
Right.
The emergency physician is often that first point of contact
Yeah.
and plays a key role in that initial assessment, ordering tests, kind of getting the ball rolling.
Makes sense.
Radiologists are essential for interpreting those imaging studies, things like X-rays, CT scans, ultrasounds.
Right. Got it.
And if there's a pelvic fracture or other injury to the female reproductive system, a gynecologist might be called in as well.
So it's a truly coordinated effort.
Absolutely.
Everyone's got their part to play.
Exactly. And it's not just about managing that immediate crisis.
Right.
We also need to think about long-term care and rehabilitation.
Absolutely.
Physical therapists, occupational therapists, mental health professionals,
Right.
they can all play important roles in helping patients regain function and cope with the emotional and psychological effects of that trauma.
Now, speaking of things that often get overlooked,
Hmm.
I wanted to touch on those iatrogenic injuries again.
Okay.
We mentioned them briefly before, but I think it's worth circling back to them because they're more common than people might realize.
You're right, and I think it's important for people to understand that these injuries can happen even during routine procedures. It's not always about negligence or incompetence.
Right.
Sometimes it's just a matter of anatomy.
Yeah.
Those ureters are very small and delicate, and they can be easily damaged during surgery, especially in the pelvic area.
So it's a risk that comes with any surgical procedure.
To some extent, yes, but certain procedures carry a higher risk than others. Pelvic surgery, particularly gynecologic procedures, is a common culprit for those ureteral injuries.
Okay.
And procedures involving the prostate or bladder, like biopsies or tumor removals, can also lead to bladder injuries.
So if you're undergoing one of these procedures, it's important to have, like, a frank conversation with your doctor about the risks.
Absolutely. Informed consent is essential. Your doctor should explain the potential complications of the procedure and what steps they'll be taking to minimize those risks.
And if you experience any, like, unusual symptoms after a procedure, things like pain, fever, or changes in your urination, don't hesitate to seek medical attention.
That's right. Early detection and treatment are key for minimizing the impact of any iatrogenic injury.
This has been a really informative deep dive. I feel like I've learned so much about a topic I knew very little about before.
I'm glad to hear that.
Knowledge is power.
Absolutely.
And understanding these injuries can really help people advocate for themselves and make informed decisions about their health.
Absolutely.
Now, before we move on to the final part of our deep dive, I wanted to touch on something that the authors only briefly mentioned,
Okay.
but I think it's incredibly important,
Okay.
and that is the long-term outcomes after urologic trauma.
That's a great point. It's something that deserves much more attention. These injuries can have a lasting impact on a person's life, both physically and emotionally.
Absolutely. We've talked about, like, the risk of complications, things like stricture formation, erectile dysfunction, but what about the broader impact on, like, their quality of life?
Well, think about the things we take for granted. Going to the bathroom without pain or leakage.
Yeah.
Being intimate with our partners.
Right.
Feeling comfortable in our own bodies.
Yeah.
Urologic trauma can disrupt all of these things.
And I imagine the psychological impact can be significant as well.
You're right. Trauma can be a very emotionally distressing experience.
Yeah.
And it can take time to process and heal from those wounds.
So it's not just about fixing the physical injury.
Not at all. It's about restoring the whole person.
Right.
Body, mind, and spirit.
Now, in the final part of our deep dive, we'll delve deeper into these long-term outcomes and discuss some of the emerging research in this area. Stay tuned. You know, it's really striking to me how much, when we talk about urologic trauma, the focus is on that acute phase.
Right.
That immediate injury and treatment, but as we kind of alluded to before.
Yeah.
Well, not a break hot, there isn't one.
Right.
But the after effects, the ripple effects of these injuries can really be felt for years, you know?
Yeah, you're absolutely right.
It's like the aftershocks of an earthquake.
Exactly. And while modern medicine has become incredibly good at, saving lives and repairing that physical damage, that road to a full recovery can be long and winding. And unfortunately, that's an aspect that often gets overlooked.
The article we're talking about only briefly touches on this.
Right.
But it's clear that Santucci and Bartley really see these long-term outcomes as a crucial area for future research and attention.
Absolutely. They highlight that these injuries, especially those involving the urethra or the genitals, can have a profound impact on a person's quality of life.
Yeah?
And it's not just about the physical limitations. Those emotional and psychological effects can be just as significant, if not more so.
Well, let's break down some of those long-term challenges. What are some of the kind of the most common issues people face after urologic trauma?
Well, one of the most significant is urinary incontinence,
Okay.
which is the inability to control urination.
Right.
And this can be devastating for people, both physically and emotionally. Imagine the impact on your daily life. Constantly worrying about leaks, having to restrict your activities, feeling self-conscious, embarrassed. It can really take a toll.
Yeah, it's easy to see how that could affect, every aspect of someone's life, their work, their relationships, their self-esteem.
Exactly. And the causes of incontinence after urologic trauma can be complex.
Mm.
It could be due to damage to the bladder itself, or to the sphincter muscles that control the urine flow, or even to the nerves that supply the bladder.
So many factors there.
It's complicated.
And I imagine the treatment options vary depending on what the underlying cause is.
They do. There's a whole range of therapies, from lifestyle modifications and pelvic floor exercises to medications and even surgery.
Wow.
But it's often a process of trial and error to find what works best for each individual.
Okay. Another concern that the article mentions is erectile dysfunction,
Right.
or ED. This is obviously a sensitive topic, but it's one that can't be ignored.
You're right. ED can be a particularly difficult issue for men to deal with after trauma, especially if it involves damage to the penis or the surrounding nerves.
Yeah.
And it's not just about, the physical act of intercourse. It can affect a man's sense of masculinity, his self-confidence, his relationships.
Yeah, for sure. And just like with incontinence, there's no easy fix for ED.
No. There are medications and devices that can help, but they don't work for everyone.
Right.
And that psychological impact of ED can be profound, leading to anxiety, depression, even relationship problems.
It's a reminder that, trauma affects the whole person,
Absolutely.
not just their physical problem. And that kind of leads us to another critical aspect of long-term recovery that we touched on before, and that's chronic pain.
Right. Chronic pain is a major burden for many people who've experienced urologic trauma.
Yeah.
And it can be pain in the pelvis, the genitals, the lower abdomen, or even the back. And this pain can persist for months or even years after the injury, long after those initial wounds have healed.
So we're not just talking about the immediate pain of the injury itself.
Right.
This is something that really lingers, and
Yeah.
it can impact someone's life.
Exactly. And managing chronic pain often requires this multifaceted approach: medications, physical therapy, acupuncture, massage, even psychological counseling.
Wow.
It's about finding what works for each individual and helping them develop coping mechanisms to manage that pain.
Yeah, it's a whole process.
It is.
And I guess this is where that multidisciplinary care that we talked about earlier
Right.
becomes so vital. It takes a team of experts to really address all those facets of long-term recovery.
Absolutely. Urologists, pain specialists, physical therapists, psychologists, they all have a role to play.
Now, beyond the physical challenges, let's talk about that psychological and emotional impact of urologic trauma. This is an area that I feel like often gets overlooked,
Right.
but it's incredibly important.
You're right. Trauma of any kind can be a deeply upsetting experience. And when it involves such a sensitive and personal part of the body, that emotional toll can be immense.
Yeah.
People may feel violated, ashamed, even angry. They may have flashbacks, nightmares, difficulty sleeping. They may withdraw from their loved ones, avoid social situations.
I imagine, things like anxiety, depression, and PTSD are common after urologic trauma.
They are, and there's often a sense of shame or embarrassment associated with these injuries,
Yeah,
which can make it hard for people to seek help.
absolutely.
They may feel like they're the only ones going through this, or they may be afraid of being judged or stigmatized.
That makes sense. So it's really crucial to create like a safe and supportive environment
Absolutely.
for people to talk about their experiences
Right.
and to get the help that they need.
And that's where mental health professionals play such a vital role. They can provide counseling and therapy to help people process that trauma, develop coping mechanisms, and regain a sense of control over their lives.
Now, the authors of the article really stress the need for more research in this area.
Yeah.
What are some of the the big questions that still need to be answered?
Well, for one, we need better data on the long-term outcomes of various treatment approaches.
Right.
What are the success rates of different therapies for incontinence, ED, chronic pain?
Right.
How do those outcomes vary depending on, the severity of the injury, the patient's age, and other individual factors.
And how do these injuries affect people's ability to work, to
Exactly.
have relationships, to, their overall quality of life?
Right.
These are all such important questions that we really need to explore further.
We also need to develop better tools for screening and assessing that psychological impact of urologic trauma. We need to be able to identify those who are struggling and get them the help they need as early as possible.
Yeah, early intervention is so key.
Absolutely.
It sounds like there's a lot we still don't know about the long-term effects of urologic trauma.
Right.
But thankfully, there's growing recognition of how important this issue is,
Yep.
and research efforts are expanding.
That's encouraging. And I think raising awareness is also crucial.
Yeah.
The more we talk about these issues, the less stigma there will be, and the more likely people are to seek help.
Well, I think we've done a pretty thorough job of unpacking this complex topic.
Yeah.
What are some, key takeaways for our listeners?
Well, I think the most important message is that urologic trauma is serious business.
Yeah.
Early recognition and prompt treatment are essential for preventing those long-term complications.
Absolutely.
But it's also crucial to remember that recovery doesn't end when those physical wounds heal.
Right.
That emotional and psychological impact can be long-lasting. And it's vital to seek support and resources for the whole person, not just the physical injury.
And for those of you out there who've experienced this type of trauma, know that you're not alone. There are resources available, and there is hope for a fulfilling life even after these difficult injuries.
Well said.
Well, that brings us to the end of another deep dive. We hope you found this exploration informative and maybe even a bit empowering.
It's always better to be informed, even about the things we hope to never experience.
Absolutely. So next time, stay curious, stay engaged, and keep diving deep into the world around you.